your video off. We encourage questions, and we are here to really move forward. So if you'll hit that next slide, please. Wow, look at this big team here. I just want you to know 5 states are collaborating to bring this expertise to you. You will meet all of us as we move throughout this wonderful web series. And once again, thank you all for coming. Next slide, please. Okay, ladies, I'm turning this over to you.
Great. Thank you for joining us today, and welcome to the first session of Build Your Bones. We are going to talk about Lesson 1, an osteoporosis overview. I am Lori Welch, and I'm from Penn State Extension, and my co-presenter is Rebecca Elliott from the University of Florida. So I just want to thank everybody for coming today to this series. Attending this series is a step towards improving or maintaining your bone health. Another step in moving towards a healthier lifestyle for better bone health is interacting within our group and providing and receiving support. So again, I know Marie was talking about if you put in the chat where you're from, we have a couple people, but if you have a minute, why did you want attend? What was your interest? You could feel free to put in the chat to see. I know the Florida people, but we have one from my area. What made you sign up to come to this series today? See what your interests are. We'll check the chat here. Is there anything? Or a Q&A? Are we using the Q&A or the chat pod? I don't.
It looks like the chat has been disabled for this webinar, so we will get that updated next time.
That's okay. Put it in the Q&A if you're just curious why people signed up. Q&A.
Okay, there's one answer here. It says I have osteoporosis. They've had 3 DEXAs, so I think they are very interested in this. And let's see. We've got some others that are joining us from various states. We got a New Yorker on here. There is another answer. They have osteopenia. We have someone joining us from Istanbul, and they are interested in this topic. So thank you all.
That's great. Just curious, just wanted to know what the interest was. So as I mentioned earlier, over the course of the next few weeks, there's 7 sessions, and we're going to be discussing the basis of osteoporosis. We're going to talk about the tests to diagnose osteoporosis. We'll talk about medications and healthy eating and nutrients for bone health. We're also going to discuss fall prevention and balance, the right type of physical activity for your bones, and moving safely with osteoporosis. Each week, we're going to have a lesson with activities. If we do have time, there's going to be some balance exercises and some, again, if we get to do it in practice, it'll be great. If we run out of time, we'll just review them. And again, we do have a recipe book. We're going to talk about some of the recipes. So along the way, I hope we're going to have some fun, and we're all going to take steps towards better health and stronger bones. So looking at this slide here, people sometimes think that they can't do anything about preventing osteoporosis or improving their bone health if they've already been diagnosed. And a couple of things that we saw in the chat, we do have people on here that have osteopenia, which is sort of like pre-osteoporosis. And then we have a couple people that said they have a diagnosis of osteoporosis. Certainly, there's things you can't change. We can't go back in time. But the series we're going to have over the next 7 weeks will focus on what you can change. These changes can make a difference in your health now and in the future. Taking steps one at a time and building your knowledge and abilities as we go along the series can help boost your confidence as well as your knowledge. Only you have the ability to make changes and improve your health. The first step is knowledge. Just knowing what osteoporosis is and its effects and what causes the condition is very important. Knowing your own personal risk factors is especially important, since that you have the power to change some of your risk factors for the disease once you know what they are. Yes, there are risk factors that you can't change, but it's vital to know about those that you can. This knowledge will help you better discuss your concerns to your healthcare provider and then work together to take care of your bone health. Step 2 includes screening for osteoporosis and medications. Screening will let you know your bone mineral density, which is the current status of your bone health. Also, it's important to know about the medications that cause bone loss over time, since there are many, some of them are very common. And there are also medications that will improve your bones. Our third step is nutrition. Proper nutrition is vital for your overall health, and we'll discuss nutrition for being as healthy as well as nutrition for building and maintaining bone health. Part of proper nutrition includes a discussion on supplements that may help strengthen your bones. Supplements may be helpful to you, but need to be taken correctly and only if they're needed. Staying strong includes physical activity that helps strengthen bones and prevents falls, especially weight-bearing exercises and balancing exercises. That is the focus on our fourth step in building bones. I also, and everybody on the team, will encourage you to talk to your healthcare provider about bone health and what steps they recommend you take. Everyone is different, and your healthcare provider can help you take the best steps for your individual needs. So this week in session 1, we are going to talk about the basics of osteoporosis. What is osteoporosis? What causes it? What's your personal risk? Others may have already been told that you have osteoporosis or even had a bone fracture caused by weakened bones. Perhaps some of you think because you had good results from a bone scan or have no family history that you don't have to be concerned about osteoporosis. Others may be wondering if you should be getting a bone scan in the near future. We get kinds of all informations about it. Osteoporosis comes in the newspaper, on TV, social media, from our friends and relatives. So today's session, we'll be answering some of these questions, and then we'll build on them and learn each week to give you the knowledge and tools to help prevent or control osteoporosis in your life and in the lives that you love. So we are going to get started. And I just want to encourage people, I know 7 sessions is a lot, and if you can attend every session, because we do build upon, but I'm glad that we do have the recording available in case you're unable to attend. So, okay. Osteoporosis, sometimes we call it the silent thief or the silent disease because bone loss occurs without any symptoms. People often don't know they have osteoporosis until a sudden bump or fall or sprain causes a fracture. Some people's bones are so fragile that even a sneeze can cause a fracture. Collapsed vertebrae may be a first thought, just as back pain or bad posture, but they cause people with osteoporosis to lose height and have a stoop posture. For some people, sometimes they call it a Dowler's hump. This stoop posture has other effects, including extra pressure for each inch of protrusion, which can cause neck or back pain. Osteoporosis can have a big effect on a person's quality of life. In addition to the disability that may be caused by a fracture, people often fear that they will fall and break a bone. This fear keeps them from being active and even being social. Lack of activity and socialization can start a downward spiral in your health. Preventive measures, proper diagnosis, and treatment are vital in maintaining our overall health as well as bone health. Throughout the series, we're going to focus on a number of aspects of bone health, as well as working to improve your balance and reduce your risk of falling. Small changes can make a large difference. So we're going to give you some statistics here. By 2025, which is next year, the medical costs of bone fractures due to osteoporosis may rise to over $25 billion a year. The cost of osteoporosis is more than just medical costs. Other costs can include loss of income, loss of independence, either temporarily or permanently. Osteoporosis can also increase stress on individuals, their families, and their caregivers. So who's at risk? Osteoporosis is a major threat to our health, with more than half of the people over 50 and over at risk. An estimated 54 million adults in the U.S. have osteoporosis or low bone mass. Osteoporosis is not just a disease of women. 32% of those at risk are men. Osteoporosis causes an estimated 2 million broken bones each year and often results in immobility, pain, can be placed in a nursing home, isolation, and other health problems. Although the disease is common in older adults, it can strike at any age. The incidence of osteoporosis and osteopenia, which is low bone mass, is increasing. It is projected that the cases of osteoporosis and osteopenia in the neck and spine for adults 50 years of age and older who are not institutionalized, compared with well-known increase, we should get an increase about 32%, which would bring us up to 7.2 million, and that's an increase from 2010 to 2030. So by 2030, it is expected that 57.8 million will have low bone mass. So what is osteoporosis? Literally means porous bones. As we age, for a number of reasons, our bone loss, the part of the structure of the bones that makes them strong, they become less dense. This bone loss results in fragile bones that fracture more easily. You can see the picture on the screen here. Our normal healthy bone kind of looks like a sponge. This sponginess gives our bones strength, flexibility, and the ability to absorb shock. In the bone with osteoporosis, there are very large holes in the spongy matter, making it easier to break a bone. Many people think osteoporosis is something that normally happens to people as they get older, and they can't do anything to prevent it. Yes, there are naturally some changes to bones as we get older. However, osteoporosis is not a natural part of aging. Over the course of this program, we're going to look at all the causes and ways to prevent and reduce osteoporosis. One of the most important things I hope you learn from our time together, you are never too old or too young to improve your bone health. And here's a closer look at the bone without osteoporosis. Notice the big gaps in the bone. Again, one with and one without. Sorry about that. Notice the big gaps in the bone on the right. The spongy inner layer of the bones is weakened and more prone to breaking. Okay, I am going to turn this over to Rebecca. I'm sorry, Rebecca, I think I took your slide, so.
Hi, everyone. Good afternoon. Let's talk about low bone mass or osteopenia. As we have seen, osteopenia or low bone mass is a growing problem in the US. Osteopenia is a stage in between normal bone density and what is diagnosed as osteoporosis. Although people with osteopenia have a high risk of developing osteoporosis, many of them never progress to osteoporosis. Still, having osteopenia is associated with a higher fracture risk than having normal bone density. And in fact, more than half of fractures in postmenopausal women occur to those with osteopenia rather than osteoporosis. There are a number of factors that may cause osteopenia and osteoporosis. These include heredity, less than optimal bone development during youth due to poor nutrition, particularly low in calcium and vitamin D, abnormally accelerated bone loss, and the presence of certain medical conditions or use of medications that affect bone density. For example, having type 1 diabetes increases the risk of osteoporosis. And we'll be talking about all of these risk factors. Next, please. So many of us take our bones for granted, right? But just think about where you would be without them. Our skeleton supports our entire body, so allows us to get around and provide us the structure that holds us together. And the human body has 206 bones, from tiny ones in our hands and feet to large structural bones in our arms and legs. They help to protect our vital organs and are a storehouse for essential minerals, primarily calcium and phosphorus. Your bones are living and growing tissues. They are mostly made of collagen and the mineral calcium. Collagen is a protein that makes up the soft framework of the bones, and calcium adds a strength and hardens the framework. The combination of the two make your bones both flexible and strong. Did you know that about 99% of your body's calcium is in your bones? The other 1% in your blood. There are two types of bone in your body. We have the cortical bone, is the hard outer layer that is dense and heavy. And the trabecular bone is the spongy inner layer. The center of the bone contains the bone marrow, where blood cells are produced. So different bones have different percentages of cortical, the hard one, and the trabecular bone. Long bones in your arms and legs contain more of the hard cortical bone, and that makes sense, right? Other bones, such as the wrist, vertebra, and pelvis, are mostly made of trabecular bone, with a thin covering of cortical bone. So the trabecular bone is more susceptible to osteoporosis than the harder cortical bone, which is why the wrist, the spine, and the hip are the places most likely to have a fracture due to osteoporosis. Next. So our bones are growing and renewing themselves constantly. Throughout our lives, our bones go through processes called modeling and remodeling. When we are younger, bones grow in both length and density. Even after bones stop growing in length, the density continues to grow. This is modeling. In the remodeling process, old bone breaks down and is replaced by newly grown bone at the same site. The process changes as we age, and over time, the bone breaks down faster than it can be replaced. And this leads to loss of bone density and strength over time. Here's a closer look at the highly complex process. You can see that we have osteoblasts and osteoclasts. These are two types of different cells. The osteoblasts on the left side, these are cells that are involved in bone building. They are bone building cells. What do? They aid in bone formation, lays down layers to increase the bone strength. They pick up the calcium from your blood, from your bloodstream, and deposit it into your bone. On the other hand, we have other cells called osteoclasts, and they disassemble bone as part of the remodeling process. And how do they disassemble bone? They dissolve the minerals, especially calcium, and move this calcium to the bloodstream. You can see this image below. It's an image of a vertebra. Can you see the mouse? My mouse here? Okay, the first
Where do you want it?
part of the vertebra
Right there.
is a normal vertebra. It is square-like. The one in the middle, you can see that's not a square-like. In the bottom part, it has a wedge deformity. The last one, it has a biconcave deformity due to osteoporosis. So you can see the difference of a normal vertebra compared to other stages of osteoporosis. Next slide. So let's talk about bones over time. Bone mass peaks for most people about age 30. And you can see the image, the lady at age 30. And after 30, bone slowly begins to exceed bone formation. The peak bone mass is influenced by genetic makeup, your gender, your hormones, and your lifestyle. Something you can control. An example of the effect of hormones is the rapid loss of bone when women go through menopause and estrogen levels drop. So this is a critical time for women to pay attention to their lifestyle to prevent excessive bone loss with their change in hormone levels. And how do we do that? Nutrition and exercise play an especially important role in building bone mass early in life and maintaining or even building bone mass to some extent later in life. It might help to think of your bone mass as being like a savings account. The more you put in while you're younger, the more you'll have later in life. Remember, you're never too old and never too young to start making changes that will benefit you as you get older. The one before, please. Calcium through the years. I think it's the slide before. Okay. This one. Thank you. So calcium is a major building block of bone. That is why good nutrition is important, especially for young people. Calcium needs change during our lifetime. We need more in our youth and during pregnancy. Women after menopause and older men also need to consume more calcium to help counter the effects of age on bone density. Women can lose up to 20% of their bone mass in the 5 to 7 years following menopause, making them more susceptible to osteoporosis. In men, sex hormone levels decline more slowly, and men experience bone decline around 50. By age 65, men and women tend to lose bone at about the same rate. So this gradual bone loss continues throughout life. And we're going to look at how our bone loses calcium over time. So I'm going to show you some replicas representing how we lose bone over time. Okay, let me change the camera first. Give me a second. And remove the background. Okay. Let me move to the other side. Okay, everyone, let's pretend, imagine this. You are a well-nourished 35-year-old woman with a small to medium build, okay? So this container of salt represents the calcium in your bones. It is 4 cups of salt, like 4 of this, that represents 1,000 grams of calcium. So life is good, you're going about your life, getting a little older each year, losing a little calcium from your bones, and then, bam, you hit age 52 and begin to go through menopause, okay? So I would like you to, well, actually the chat is not able, but what do you think that happens when you hit menopause? Well, bone loss speeds up. So women lose bone rapidly the first 5 to 7 years after menopause. And what is actually menopause? Menopause is described as a full year with no menstrual periods, okay? So to demonstrate this bone loss, I took out 2 tablespoons of salt from this container, representing each year after menopause. So let's say now that you are 58, okay? And it has been 6 years since you went through menopause. So I took out 12 tablespoons of salt, and this is how it looks like at age 58, okay? So how many cups of salt will that be? This represents like 3/4 cups, or about 20% of what was there. So this represents like 20% of what was here. Of your 4 cups of salt, you now only have 1/4 cups remaining. So look at the difference. In 6 years after menopause, you will have lost close to 20% of your bone calcium. And as you get older and continue to lose calcium, so time goes by and you are now, let's say, 85 years old. Okay? A woman with osteoporosis. So I took out 14 more tablespoons of salt, representing about 220 grams of calcium. At age 85, you've now lost more than 40% of your bone calcium since you hit menopause. So your bones are much weaker than they used to be. Is this calcium and bone loss inevitable? Are you really doomed to have osteoporosis? Well, the answer is bone loss is inevitable because it's part of aging. But osteoporosis isn't. In other words, you cannot avoid the bone loss as you age, but you can avoid osteoporosis, okay? So I want you to remember those controllable risk factors we talked about, such as lifestyle, such as nutrition. No matter what you did in the past, you can choose to continue bone building habits and discontinue any bone weakening habits you may have had. So the actions you take now will build your bones for later life or help to maintain them as you age. And remember, you are never, never too old or too young to improve your bone health. So let me change the camera here very quickly.
While you're doing that, it's a very good visual on showing how fast you can really lose that bone.
That is right. So, Lori, can you please share the slides again? So the effects on bone mass. So although our skeleton is influenced by genetics, it can be greatly affected by 3 other factors. We have to consider not only genetics, we have to think about hormones, physical activity, and nutrition. We will be focusing on physical activity and nutrition a little later during other classes. So during this class, let's talk more about hormones, okay? So hormones, primarily estrogen in women and testosterone in men, have a protective effect on our bones. Estrogen plays a role in the balance between bone formation, the modeling, and bone breakdown, the remodeling. And as we age, the circulating levels of estrogen decreases, breaking the balance by increasing the rate at which our bones tissue break down. So something similar happens with testosterone. Low testosterone is responsible for about half of the cases of osteoporosis in men. So lower testosterone often is associated with aging. But certain medical conditions and medications may cause lowered levels. Blood tests are used to check levels. Next slide. It's you, Lori.
Okay, I am ready. Just want to make sure. Perfect. So thank you very much. Love the demonstration. I thought it was awesome. So looking at risk in another way, according to the National Osteoporosis Foundation, a woman's risk of hip fractures equals her combined risk of breast, uterine, and ovarian cancer. Using bone building strategies to reduce your risk of osteoporosis can decrease your likelihood of fracture. We have a nice picture of a hip there. And we're getting to the men. I don't know if we have any on the men on the call today, but we're getting to the men eventually because we've been talking a lot about women. But who is the most likely to have osteoporosis is often thought as a disease for old white women. This is not quite true. Osteoporosis can occur at any age and in all races. However, women do account for 80% of osteoporosis cases. Thus, the big concentration on that. And about 20% of Asian and non-Hispanic white women and 50 and older have osteoporosis. Although Caucasian and Asian women are more likely to have osteoporosis, the disease is increasing in both sexes and all ethnicities. Low bone mass, also known as osteopenia, occurs before osteoporosis. Bone loss is a gradual process and happens without us even knowing about it. Our first indication is the gradual loss of bone. Usually it's a fracture that happens. Another indication may be decreasing in height, shrinking a little bit. That's why it's so important to take steps now to maintain or improve bone health. An estimated 52% of Asian and non-Hispanic white women have low bone mass. The risk of low bone mass for Hispanic and Black women isn't as great, but is still significant. Okay, so let's not forget about the men. A common misconception is men do not get osteoporosis, and this could not be more wrong. About 2 million men in the United States currently have osteoporosis, and another 12 million are at risk. About 20% of all people with osteoporosis are men. White men appear to be at the greatest risk for osteoporosis, but all men from all ethnic groups can develop osteoporosis. Osteoporosis in men tends to be underdiagnosed, underreported, and again, there's not a lot of research out there. It is less common in men than for women for several reasons. One, men have larger skeletons and their bone loss starts later in life, usually around age 70. When the disease progresses, it does so more slowly. Men do not experience the rapid bone loss that affects women when their estrogen production drops as a result of menopause, just like Rebecca said earlier. However, decreased testosterone levels in men as they age throughout the life could be a reason for bone loss. More research about men and osteoporosis is needed. Research has been more focused on women because of their greater likelihood of getting the disease, but there are more studies taking place all the time. Although an estimated 20% of people with osteoporosis are men, they account for 29% of all osteoporotic bone fractures. Men account for about 80,000 hip fractures every year. Men are more likely than women to die as a result of a fracture. As mentioned earlier, osteoporosis in men is sometimes related to a decrease in testosterone levels. Two areas of concern are the condition called androidism and treatment for prostate cancer. This condition in men is when the body does not produce enough of the male sex hormone. It may be caused by an autoimmune and genetic disorder. It can be caused by radiation exposure and other health issues. About a third of men with osteoporosis have this disease or disorder. An estimated 4 to 5 million men have this condition, putting them at risk and an increased risk for osteoporosis. Another concern related to men is a treatment for prostate cancer. The most common medical treatment for prostate cancer is androgen deprivation therapy, which is also known as hormone deprivation therapy. It's intended to have a therapeutic effect, but men who have prostate cancer who are treated with this androgen deprivation have been shown to be at an increased risk for low bone mass and hip fracture. Approximately 1/3 of the estimated 2 million prostate cancer survivors in the U.S. are currently receiving this treatment. Prevention of osteoporosis begins when we're young. Bone development in our youth or more commonly lack of bone building will affect bones as we get older. Poor overall nutrition, as well as calcium consumption and lack of physical activity, places a large number of our youth at our future for risk in the future for developing osteoporosis. Frequent dieting for weight loss is an additional factor, particularly in individuals who go on crash diets that take in very few calories, can interfere with the hormones needed to build and maintain bone. Furthermore, dieting without the guidance of a professional may lead to underconsumption of good sources of calcium or vitamin D, which are needed for building and maintaining healthy and strong bones. The most common fracture sites you're going to see in this photo here, low bone density can occur in any bone, but the most common fractures due to loss of bone occur in the hip, the spine, specifically the vertebrae, and the wrist. Although fractures happen in these three main areas, other bones can break as well. So if you look at this graph here, hip fractures account for about 15% of osteoporotic bone fractures, spine or vertebrae about 27%, and about wrists account for about 19% of fractures. This leaves about 39% fractures occurring elsewhere. Although hip and vertebrae fractures only account for 42% of the fractures, those are the ones that have the greatest impact on a person's health and ability to maintain good health and independence. And think about how important it is to walk around if you have a broken hip or if you have something wrong with your vertebrae. Wrist fractures are usually the result of trying to stop a fall, but can result in significant reduction in the ability to do regular daily activities, such as preparing meals, completing household chores, and other things. We've all heard of someone, whether it be a family or a loved one, who's had a hip fracture or broken hip. It can severely impact a person's life. About 1 in 5 hip fractures in patients over 50 actually die in the year following the fracture from associated medical problems. Often a hip fracture starts a downward spiral to health. Fracture of the vertebrae are the most common osteoporotic fractures. These fractures can also have significant effects on health, quality of life, and the risk of death. Fractures in the spine also may have serious complications that include chronic back pain, a curved spine, loss of height, stoop posture, and disability. Not all fractures in the vertebrae cause pain. And just because your back pain doesn't mean you have osteoporosis. There are many causes of back pain, such as muscle pain, nerve problems, but pain from fractures due to osteoporosis are usually felt in the middle or mid-upper back, and the pain could be from severe to mild. Fractures in the spine may result in the loss of height, as you can see in this diagram. As the spine bends, people kind of shrink up a little bit. When you have severe osteoporosis, there may be fractures in the vertebrae, which can cause a loss of 5 to 8 inches in a person's height, which is a lot, especially if you're a short person. I know we're on Zoom, but I'm only 5'2", so I'd be really short. There's a suggestion from the book of Strong Women, Strong Bones, for all women over the age of 35 to start measuring their height once a year, preferably in the morning. Like we do, we used to keep track of the kids' growth on the chart, but a loss of more than 1.5 inches may indicate that there's a fracture in the vertebrae. When we think about osteoporosis, we also think about what we call as Dower's hump. This is usually caused by a wedge fracture of the spine. A wedge fracture is one in which the front part of the vertebrae gets crushed, but the back part remains intact. A reduction in height may be noticed in individuals affected by a wedge fracture. And if you look here in the photo, the woman dressed in blue, she's standing pretty upright, and as the women, just showing different women with different variants of the curvature of the spine, and they become a little bit humped over, causing humps in their back, also a loss in the height. About 1 in 7 osteoporosis related fractures occur in the hip, but not all hip fractures happen due to a fall, which is why doing all you can to prevent falls is important. We're going to spend a lot of time on fall prevention in the next coming weeks. Every year, about 300,000 people over the age of 65 end up in the hospital due to a hip fracture. And of those who experience a hip fracture, about 16% of those died within 1 year. A fractured hip may start, like we said earlier, a downward spiral in health and independence due to maybe having surgery and being immobile. About 60% of people who break a hip never reach their previous level of independence. And once a hip is fractured, there is a high risk of another fracture. Having this type of fracture may result in the person becoming fearful of another break, causing them to become isolated, depressed, and possibly even afraid to leave their home. Research suggests a link between osteoporosis and tooth loss. As the jawbone becomes less dense due to osteoporosis, teeth may become loose and eventually may fall out or be lost. Women who have osteoporosis are 3 times more likely than those without the condition to lose their teeth. Bone loss can make it difficult to have dentures fit properly. Poor chewing ability can affect dietary intake and a cycle of beginning to choose less than optimal foods and less of variety because it's harder to chew and digest. Okay, I am going to return it over to Rebecca. And let me know, Rebecca, when you want me to show the handout.
So we have another slide after this before we do the handout.
Okay.
All right, so the question you might be wondering, am I at risk? So who is at risk for osteoporosis after all? As we've just seen, osteoporosis affects men and women and people of all ages and ethnic groups. It is not just an old person disease. Young people, even teenagers, can get osteoporosis. So osteoporosis is called a multifactorial disease because there are a number of causes. Some risk factors are uncontrollable. That means you cannot do anything about them. But you can impact a number of risk factors, like your lifestyle, which you can really make a difference. So let's look at your personal risk for osteoporosis. Before we start, I want to make it clear that no matter what your risk, you have control of your lifestyle, as I mentioned before. You are never too young or too old to improve your lifestyle choices and potentially decrease your risk for osteoporosis. So we have a form that you can take a look. It's called, Are You at Risk for Weak Bones? And I would like you to take a look, check any of these that apply to you. You can count. Am I older than 65? I've broken a bone after age 50. My close relative has osteoporosis or has broken a bone. My health is fair or poor. I smoke. I'm underweight for my height. I started menopause before age 45. I've never gotten enough calcium. I have more than 2 drinks of alcohol several times a week. I'm not active, or I have 1 or more of these medical conditions below, such as hyperthyroidism, chronic lung disease, cancer, inflammatory bowel disease, chronic hepatic or renal disease, hyperparathyroid, that's funny, hyperparathyroidism, vitamin D deficiency, Cushing's disease, multiple sclerosis, rheumatoid arthritis.
So these handouts were actually emailed to all the participants. So they can actually do this. They can stop, they can look at it and really go through and take their time, look at it and tally their score. But absolutely, it's priceless information. No,
Excellent.
she emailed the link, excuse me. Poor Wendy. She's hung out in telephone land. But the link is there for them to get to those handouts.
Excellent. I had no idea that everyone had received a copy
Yeah,
of.
we weren't sure. This is a pilot, so great.
Excellent. So take your time, check how many risk factors you have. And remember, even if you have risk factors, more than one or several risk factors, you can still control your lifestyle. That will improve significantly your bone health. So next slide, please.
I'm looking for it. Hang on. Since I
No
shared
problem.
my screen. Yeah. There we go. I think we're good. Hang on.
Slide 30.
Yep, here we go. Good.
So were any of you surprised by your risk of osteoporosis? As I was reading, did you count how many risk factors you had? Well, genetic factors may account for 50 to 90% of bone mass. And these are uncontrollable risk factors for osteoporosis. The things that you can't change. We won't spend a lot of time discussing this since you can't do much about them. Other factors account for up to 50% of your bone mass, and we will spend more time talking about those. So there are a number of things you can do to reduce your risk for osteoporosis. We'll be talking about what you can do over the next few weeks. How about your diet? Your diet has an effect on your bone health. A diet low in calcium and vitamin D makes you more prone to osteoporosis. People who have eating disorders such as anorexia nervosa or who frequently diet to lose weight are also more susceptible. Did you know that? So besides diet, your overall lifestyle affects your bone health. People who don't get much exercise or those who must spend a lot of time in bed are more likely to get osteoporosis too. So the type of exercise you choose also may affect your bone health. How about cigarettes? Cigarettes aren't just bad for your heart and lungs. Smoking also can lead to bone loss. Did you know that? Risk of osteoporosis is yet another reason to quit smoking. Another factor, another controllable risk factor, is excessive use of alcohol. It increases your risk as well. Excessive alcohol consumption not only leads to bone loss, but also increases the likelihood of poor nutrition and increased risk of falling. Another risk factor are your sex hormones. They affect both men and women, testosterone for men and estrogen for women. How about medications? Well, long-term use of some medications can cause loss of bone density, and this includes some anticonvulsants and steroids. It is important to discuss your medications with your healthcare provider and pharmacist. And we'll talk more about medications next time. Secondary causes. These are a number of diseases and conditions that causes what is called secondary osteoporosis. It is important to discuss your risk with your primary health provider, especially if you have any of these conditions or have had them in the past. And some of the conditions are, as you can see, even type 1 diabetes. They increase. So if you have any of those, it may cause osteoporosis. It increases your risk of developing osteoporosis. Next slide. So talk to your healthcare provider because osteoporosis is diagnosed through a number of steps. These steps include a physical examination, medical history, and blood and urine tests. And depending on the outcome, a bone mineral density test may be ordered. it is important to discuss your risk factors with your healthcare provider. He or she may want you to have a bone density test. So things to discuss with your provider includes your personal risk factors, medications you take, your diet, whether you should take calcium and or vitamin D supplements, and if you should be tested. So now, Lori.
Thank you, Rebecca.
You're welcome.
Oops. I'm having my counter thing keeps losing here. Losing my sorry. There we go. Sorry about that. So today's first step, building our bones. We talked about facts and statistics. We've talked about what osteoporosis is. We took a look and we did that little fact sheet. And again, that was emailed to you. So you can do it about what your own personal risk factors are for developing the disease. And everyone has risk factors for osteoporosis they can't change. So think about in your mind, we talked about the ones that we can't change. We reviewed them. We can't change our age, our sex, and some of the things on there. So we're not going to worry about the things that we can change. We're going to identify it and acknowledge it, but we're really going to concentrate on the things that we can change. So we also talked about our risk factors that we can control and make positive steps to improve. So just knowing the facts and your own individual risk factors is the first step in maintaining or improving your own bone health. So as we move through the 7-week series, we're going to look at the individual steps to building bones. So we're going to kind of review some key points, and then we're going to have the opportunity to take some questions. Osteoporosis literally means porous bones. Often people do not know they have osteoporosis until they experience a fracture. Our skeleton is influenced by genetics, hormones, physical activity, and nutrition. Osteoporosis is often thought as a disease of old white women, but it can occur at both sexes and all ethnicities, like we talked about earlier. Things that you can do to reduce your risk for osteoporosis include having a diet with enough calcium and vitamin D, exercising, avoiding smoking and excessive alcohol, and discussing your medications with your healthcare provider, such as some long-term medications that actually cause the loss of bone density. So this was probably emailed to you as well, I'm assuming with all the handouts, but we have this today where we're asking you today, if you didn't have it, you can just jot it down on a piece of paper. Your personal risk factors that you can change. So take a few moments now after today when you're reflecting on it. 2 things that you can do that you can change that's a personal risk factor for you. The second one is decrease my risk. This week I plan to. This is sort of an action plan. Things that you can do this week between now and session 2 that you're going to try to start doing. Any barriers to the plan that you have, things that might interfere with you reaching some of the goals or messing up your plans, and then to overcome the barriers. So again, remember you're never too old or too young to improve your bone health. So while this class is voluntary and we're not going to give you homework, your unofficial homework is to take a few minutes to fill this out, whether it be on the form that you were emailed, on a piece of paper, because on session 2, they're probably going to talk about it a little bit. Does anybody have any questions?
So there was one that was put in the Q&A just a few minutes ago, and it was about being diagnosed with osteoporosis, and then once you've been diagnosed, can that be reversed? And this is the premise behind this whole webinar series is if you have the diagnosis of osteoporosis, no, we cannot truly reverse it, but we can give you tools. You can have more education and open dialogue with your physician with the knowledge that you gain from attending here. So, we will talk about, I think the next session is maybe medications. We're going to address nutrient dense dietary intake that can help you. Also, some weight bearing exercises. So, those are all tools to help you maintain what you currently have and maybe build a little bit more back. But, that again is what we're trying to do here. We want to educate you. We want to spark or create some awareness in your mind, and then promote some positive steps in your life where you can take advantage and be proactive and try to prevent things from getting worse. So, the other thing that was placed into there was somebody said they didn't receive an email yet of the handouts, but we promise that we will get those all out to you. And then, and so another question was, is there a blood test for diagnosing osteoporosis?
Typically, from what I understand, it's the bone density test, which is the DEXA scan. There
Yes.
may be something indicated in your blood work, but I do not believe that's a real diagnostic tool used for
No,
that.
it's not. A DEXA scan is the best way to get that done.
Yep. And we were going to have an evaluation, which I want to show, but Rebecca and I didn't have a lot of time because this is new to us, and I wanted just to show you quickly. Balance is a huge part, and when we talk about it later in the week, there are things I'm just going to run through them quickly. We're not going to have time to practice them, but there's balance exercises that help you to prevent falls. Include lower body and strength exercises. Again, you always want to stay safe. Add more challenging exercises, find a buddy or a class. You always want to check with your healthcare provider before starting any exercise program, but these are just some examples of simple exercises that you can do to help maintain balance to reduce your risk of falling. This is the stand on the foot. Again, it gives the directions right here. You can see they're using the chair for the support. You hold the position and you're going to repeat. This is another one that can be done. The heel to toe walk, it gives you the directions, and you are going to get a recording of this presentation. So you'll also see the slides. So if you want to check for these at home, again, we didn't want to run out of time. There's another balance walk. Again, these are a series of exercises that will be helpful to maintain balance, increase balance, so you are at risk of falling. So then I'm going to go back. Yep. And
I have another
Yep.
question.
Yep.
And it was about the connection between type 1 diabetes and bone loss. And the long and the short of it, if you go back to and you remember where Rebecca was talking about osteoblasts that build and osteoclasts. So the osteoblasts are the ones that help build, and the short answer is that there are some issues with how that those functions occur, and that's in type 1 diabetes. So, that would be something really you could talk with your either if you see a nutritionist or maybe your nurse practitioner or physician. But that's the short answer, is that it works against the functions of rebuilding the bone. We do have someone here who states they have had some improvement over the last 7 years with nutrient dense diet and exercise. So that is really awesome. And we're still glad you're here because you can share your story and your successes and maybe help inspire some others also. Will there be a handout of the slides? I believe that is also included in the package that Miss Wendy Wood will be handing out or emailing out. And I know that they are going. I have another one here. We are 70 years old and we require to have milk with our school lunches. Students today are not. What is being done to encourage adequate bone development in youth? I cannot speak for everywhere and all around the world, but I am married to a PE coach, and he actually borrows all of my plate and all of my food stuff. And he does a dietary intake class with his kindergartners through fifth graders. So I know that he cares enough to try to send that message across. I don't really know what the curriculum is, and this is a multi-state webinar, so I'm not really sure, but anyway, it's just kind of one of those deals. I would like to say that there is some nutrition being taught in schools, and my plate is part of that, but I can't speak to all the states. I had a compliment, very good session. Forgive me, but I cannot remember who is sponsoring this. Well, this is sponsored by Multi-State Extension. So it's cooperative extension. So we have a wide variety of states represented. Rebecca and I are with Florida. And I'm sorry, Lori, you said you are in
Penn State.
Penn State. Next week, I will be teaching with a counterpart from North Carolina State University. So thank you for joining us. Let's see.
Maria, I have the QR code up. I have the link in the chat, but I can't get it into the Q&A. So if people have the availability of, using the QR code with their phone to take the evaluation, that would be great. If not, we can ask that Wendy send out the link to the evaluation of this session with the other materials as well. I can't get it into the, can you get it in there? Okay. I can't get it into the Q&A, so.
Yeah, I don't think I can do that.
Yeah, and that's okay.
But please send the stuff. And then thank you, Heather, for providing us with the chronic rheumatoid arthritis and then how it connects with Crohn's and asthma and many different things. We will happily look that over. Good program. I'm looking forward to the remainder of the session. It worked fine. I'm hoping that was the QR code. Which I
Good.
and if you
And I
guys
put this up, that's their homework for next week.
yeah. So thank you, very informative. So great job, everybody. I don't know if anyone has stopped the recording yet, but we can go ahead and get that stopped. I know we're just a few minutes over. Can you put that QR code back up one more time?
Sure thing.
Okay. Yeah, the QR code. All right. We'll give everybody a few more minutes, and we look forward to seeing everyone next week.